Good evening, everyone. My next video is on the topic urinary antiseptics and treatment of UTI. In this video, I will discuss with you urinary antiseptics, and in another video, I will discuss with you treatment of UTI. And before I start my video, I want to request you if you like this video and if it is helpful and useful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Now, I'm going to start with you on the topic urinary antiseptics. So, urinary antiseptics, these are the oral agents that exert antibacterial activity in the urine. They exert the antibacterial activity in the urine but have little or no systemic antibacterial effects. Means they are concentrated in the urine and they have the antibacterial activity in the urine and they have no systemic or they have no antibacterial effects in the system. The usefulness is limited to low urinary tract infections. Now, the urinary antiseptics, these are more useful in the infections of low urinary tract. Drugs which in orally tolerated doses attain antibacterial concentration only in urine with little or no systemic antibacterial effect. These are the drugs which are given orally and they have the antibacterial activity in the urine only and they have no systemic antibacterial effect. Low urinary tract infections are the urethritis, cystitis, prostatitis. Upper urinary tract infections are the pyelonephritis. With urethritis, cystitis, and prostatitis are the low urinary tract infections. So the drugs used as the urinary antiseptics, these are nitrofurantoin, methenamine, and naltrexonic acid. So now, first of all, nitrofurantoin. It is primarily bacteriostatic. Bacteriostatic means it limits the growth of the bacteria and its activity is limited to the E. coli. Escherichia coli, its activity is limited. Mechanism of action, sensitive bacteria reduce the drug to an active agent that inhibits the various enzymes damage to bacterial DNA. Now, the sensitive bacteria, that is the E. coli, it will reduce the drug which is taken by the patient and it will reduce it to an active agent and this active agent will inhibit the various enzymes and it will damage the bacterial DNA. Antibacterial concentration is not attained in the blood or tissues. So antibacterial concentration is not attained in the blood or tissues, it's only concentrated in the urine. Not to be used with propane acid because azotemic patients interfere with tubular secretion of the drug. Means propane acid will inhibit the tubular secretion and will increase the concentration of the nitrofurantoin in the body. So that will lead to toxicity. It is not used with the propane acid. Primarily, it is bacteriostatic, bactericidal at the higher concentration and in the acidic urine. In the acidic urine and in the higher concentration, it is the bactericidal. Previously, many gram-negative bacteria were sensitive. Now, activity limited to E. coli. Previously, many gram-negative bacteria, they were sensitive to the nitrofurantoin, but now only E. coli is active or its activity is only against the E. coli. Bactericidal antibiotics kill bacteria. Bacteriostatic antibiotics inhibit the growth or the reproduction. So adverse reactions of nitrofurantoin is it is causing nausea, epigastric pain, diarrhea, gastrointestinal intolerance, hypersensitivity reactions like fever, chills, peripheral neuritis, and other neurological effects with long-term use. It can cause the peripheral neuritis also, inflammation of the nerves in the periphery, and neurological effects with long-term use. Hematological disorders, it can cause WBC, count can be reduced, granulocytopenia can occur, hemolytic anemia can occur in G6PD deficient patients, liver damage, pulmonary reaction with fibrosis on chronic use. It can cause the liver damage and it can also cause the pulmonary reaction with fibrosis on chronic use. Contraindicated in renal impairment, pregnancy and neonates. Contraindicated in renal impairment, pregnancy and neonates. So uses treatment for the uncomplicated low urinary tract infection. It is used in not associated with prostatitis. Supportive long-term therapy. Long-term prophylaxis following catheterization, instrumentation, and in women with recurrent cystitis. It can be given in the uncomplicated low urinary tract infection, not it's treated with prostatitis. It can be given in the supportive long-term therapy. It can be given in the long-term prevention of the low urinary tract infection, which is because of the catheterization, instrumentation, or in recurrent cystitis. Dose is 50 to 100 milligram. TDS means 3 times a day, 5 to 7 milligram per kg for 5 to 10 days. Maximum 14 days followed by rest periods. Colors the urine brown. Resistance is more common. Supportive long-term therapy, the dose is 50 milligram. BD means twice daily or 100 milligram adjusted at the bedtime. Methenamine or hexamine, it is the prodrug and its mechanism of action it decomposes slowly in the acidic urine. pH is the 5.5 or less. It will decompose in the acidic urine and it will release the formaldehyde. And this formaldehyde will inhibit the bacteria. No antimicrobial activity in blood and tissues needs to be administered with mandelic acid or hippuric acid. Why? Because these acids will decrease the pH of the urine and so it will be converted into formaldehyde and formaldehyde will inhibit the bacteria. So hexamethylene tetramine decomposition takes 3 hours. No resistance to formaldehyde. Low pH alone, bacteriostatic. Means at the low pH, it is bacteriostatic. And Proteus is the bacteria which can raise the pH by urea splitting. No antimicrobial activity in the blood and tissues. Hydrolysis is the decomposition reaction which leads to breaking down of chemical bonds by the addition of the water. And prodrug is the compound that on administration must undergo chemical conversion by metabolic processes before becoming an active. This is the what is the hydrolysis and what is the prodrug. Basically, there is no resistance to the formaldehyde, so resistance is not there with methylamine, and it is active in the low pH and it is bacteriostatic, and it has no antimicrobial activity in the blood and tissues. And its uses methenamine mandolate. It can be used in chronic and resistant UTI not involving the kidneys. And it is not effective in the acute UTI and in the catheter prophylaxis. It is effective in the chronic and resistant UTI only. Not to be used in the acute UTI, enteric was a tablet used to prevent the decomposition in the stomach. Means to prevent its decomposition in the stomach so that it may not be converted to formaldehyde in the stomach. So it is enterically coated. Mandela mean methamine mandolate tablet 0.5 1 gram TDS or QID with fluid restriction. Means we can give it in the dose of 1.1 gram or 0.5 gram. TDS means 3 times a day. QID means 4 times a day with fluid restriction. So side effects are it can cause gastritis, chemical cystitis, hematuria, occasional CNS symptoms. So it is contraindicated in the hepatic deficiency. In addition to formation of formaldehyde, ammonium is produced in the bladder. It is in hepatic deficiency, it is contraindicated because as it forms the formaldehyde, ammonium is also produced in the bladder because liver rapidly metabolize ammonia to form urea. So it is contraindicated in hepatic insufficiency in which elevated levels of the circulating ammonium ions would be toxic to the CNS. This can cause the hepatic encephalopathy because ammonia, it can metabolize the ammonia to form urea and ammonium ions. And when the urea and ammonium ions are formed, they will be toxic to the brain. So they can cause the hepatic encephalopathy. So this is contraindicated in the hepatic deficient patients. Nalidixicases is a non-fluorinated quinone, bactericidal. Mechanism of action is it inhibits the replication of the bacterial by interfering with the action of DNA guidance. Means DNA replication, bacterial DNA replication doesn't take place because it will inhibit the topoisomerase enzyme, which causes the uncoiling of the DNA for its DNA replication. So DNA replication will not take place. So DNA translation, DNA synthesis will not occur, and that will lead to bacterial death, cell death. Resistance develops rather rapidly. So uses are, it can be used as the second line drugs for the UTI. Recurrent cases on the basis of sensitivity reports, we can use this drug. Adverse reactions are infrequent, like GI upset can occur, rashes can occur, headache, drowsiness, vertigo, visual disturbances, seizures in children, nausea, vomiting, abdominal pain, photosensitivity, urticaria, and fever can occur. Just contraindicated in the infants. So phenazopyridine is the urinary analgesic. It affords the symptomatic relief and from the burning micturition, that is burning urination, dysuria, difficulty in urination, urgency in the urination. It has no antibacterial effect, and side effects are it causes nausea and epigastric pain. So that's all with the urinary antiseptics. And in the next video, I will discuss with you about the treatment of the urinary tract infections. In this video, I discuss with you about these four urinary antiseptics, that is the nitrofurantoin, methenamine, nalidixic acid, and one urinary analgesic, that is phenazopyridine. So that's all. Be happy, be blessed. Stay safe, happy learning. All the very best. Thank you. Thank you. All the very best.